In our last video, we talked a little bit about the deep plane facelift, and I focused mostly on lower face, mid face, upper cheek, and about tightening the deep planes through here. You'll hear the term sometimes used, deep plane structural neck lift. Now, what does that mean? Most surgeons who just dabble at doing facelifts, or maybe they don't do a lot and they do more body surgery, they probably won't do a deep plane structural neck lift. Patients are like onions. We have layers where we're not going to just tighten skin, but we're going to be tightening the neck through this area and giving us that sharp contour underneath the jawline. Well, the first thing is the deep plane where we're going under this muscle, the platysma, and we actually will tighten it back like a strap. A lot of times we'll tighten it in this direction in the midline, and that's a deep plane neck lift. Well, what does the structural component mean? Well, not everyone's built the same. And if you think about what makes this jawline here work so well, there's a muscle that goes from the back of the chin to the windpipe. There's other things under there at the next layer. So people are like onions, we have layers. So we have skin, we have a little bit of fat, and then we have muscle, and then we have tissue deep to that. Now that deeper tissue, sometimes it's fat, and quite frankly, liposuction can't get at it. And so that's where the structural neck lift comes in. It involves a little bit more of an incision under the chin. We'll contour that deeper fat. And additionally, while we're under there, sometimes patients will have glandular tissue, the submandibular glands that might be overgrown or they've become droopy or tautic. We'll contour the glands. There's some deeper muscle under there called the digastric muscle, and it may involve contouring the digastric muscle. And then contouring the platysma, again, this muscle here, to make room to get that really sharp angle. It's a bit more of a complex lift. From a patient standpoint, what you'll know is that afterwards it's going to be a little firmer under that area, but also we're going to have a great contour and a really sharp neckline. And so when we talk about deep plane facelift, deep plane neck lift, and then the deep plane structural neck lift, that's what it means. It allows us to give a little bit more flexibility in treating people who just have some other issues under here than just traditional fat under the skin and a little bit of muscle banding.